Hello, Dr. Alexander Hurd. My name is Richard Knapp, and I'm here to ask you about the Zika virus and what we can do to prevent its spread.
Hi, Richard. Thanks for having me. What questions do you have?
Well, first off, can you give me a brief overview of the disease?
Sure. From my research and understanding, Zika is a viral infection that is commonly passed from mosquitoes to humans. Both are, it's all known to be pretty deadly, awful side effects towards pregnancies and fetuses and whatnot. Very bad.
Oh, wow, yeah. Well, what can be done to prevent its spread?
I would recommend avoiding all contact with mosquitoes. Unlike me, wear long sleeves, cover up, avoid the outdoors, I guess, and also use repellent, either natural or chemical, your choice. Some of my colleagues have observed that the virus can be spread through sexual contact, so condoms or just avoiding sex with anyone who might be infected is a really good precaution.
Mm-hmm. Well, gosh, that's terrible. If one should get infected by the virus, how long should they wait to have kids? The spread of microcephaly in children has skyrocketed recently.
Well, what we've seen is anyone who's been infected should avoid having a child for 8 to 9 weeks or so. It's a virus, so your body naturally fights it off, but during those first few weeks, the virus can easily be spread to anyone else, and especially towards a pregnant woman. So my colleagues and I have agreed about 8 or 9 weeks is the zone where you could potentially pass it on to other people.
Wow, well, that seems reasonable. Do we have any leads on vaccines or possible better treatments for the virus?
None that I have. Some other researchers have looked into some drugs and other compounds, but there's no pure vaccine yet that can be distributed to everyone.
Oh, wow. Well, what are the drugs that have shown some promise?
Well, we have 3 main compounds so far. There's one called emerkessin, and there's another one called niclosamide. These 2 are generally FDA approved and can be distributed and purchased, but it's hard to isolate those compounds in the common drugs we use today.
Mm-hmm.
There's also one called cyclin-dependent kinase, which is known as CDK, but this is also one where we're just kind of theoretically working on right now.
All right. And do these all treat the virus the same way?
No, not really. The first one, emerkessin, works by preventing Zika-related brain damage towards cells in the brain, so preventing that, which is great, obviously.
Mm-hmm.
Niclosamide and CDK work by preventing viral replication, so they kill the virus cells before it can spread and potentially kill the person. So this is great, but still not a set vaccine yet.
Very
keep rolling.
Very interesting. Have there been any leads on combining these treatments?
Yes, actually, a colleague of mine, Wei Zhang, he found that through a combination of all 3, it can kind of prevent brain damage and also attack the virus and stop its replication, which kind of acts as a vaccine, but it's a combination of 3 different drugs, essentially.
Okay, and that is very promising and would help a lot. Can we expect these treatments to hit the open market soon? We know we have a lot of people in need.
No, sadly not. All the drugs have to go through FDA approval, which takes months or even years. We don't know how they affect pregnancies at all. These drugs are pretty strong and could really affect a pregnancy.
Mm-hmm.
It could even kill the child inside the mom by chance.
Mm-hmm.
So we have to go through some preclinical toxology tests and some clinical trials and show numbers to the FDA, and that could take probably years, which sucks because the virus is killing a lot of people right now.
Yeah, oh wow. But of course, we don't want treatments that are causing worse symptoms than they're treating. We don't want to cause a huge problem, right?
Oh, of course, I agree. Do you have any other questions?
No, that's all I have for you today. Thank you so much for your help.
Thank you for the interview.